BAMVision is brought to you by Gill, Ladner and Priest, Face Value Health, Belhaven University, JH&H Architects, Home Buyers, Will White, Benchmark Construction, Take One Media LLC, Smarts Web.
Looking to the future may feel overwhelming. Obstacles may appear too complex and intimidating. Fear blocks your foothold to earn your degree. Don't be left behind. We'll help you balance finances, work, and family on your way up. And we'll climb with you every step of the way and build your faith as we go. We've guided thousands to their educational summit because when you reach your goal, the view is pretty incredible. Belhaven University. Start today, on ground or online.
Hello, I'm Jack Chris. Welcome to the first installation of BAMVision, and we're taping from the law offices of Gill, Ladner and Priest, one of our sponsors here in Ridgeland, Mississippi. We are pleased to be joined with this first episode by Miss Martha Rosado. I always get your last name wrong, Martha.
Rosado.
And I got it wrong then, Martha Rosado. Martha, tell us, we're going to talk about a topic that unfortunately may be near and dear to a lot of people's hearts. Tell us what you do.
Sure. I am a licensed professional counselor. I have an office here in Ridgeland, Mississippi, Madison Counseling, and I'm an anxiety specialist. So I help normal people who are going through a hard time and just having some issues with worry or anxiety.
See, near and dear was probably the wrong terms because it's a very serious condition. And, you know, everybody I talk to, honestly, today, especially business people, they're anxious.
Yeah.
So my question to you as a professional is, when do you differentiate, or how do you differentiate between normal run-of-the-mill anxiety or the type of anxiety where your services would be required?
Sure. And I would just say, anxiety disorders unfortunately are very common. About 1 in 3 adults are going to suffer from an anxiety disorder throughout their lifetime. And so I think you're right. We're trying to tease apart kind of what's normal everyday stress and then where is it that you might want to seek a professional. Everybody is going to have, normal stress that kind of motivates them to get up and go and get a task done and push a little extra hard. But when you feel that chronic drive and push and it's interfering with your sleep and it's interfering with your relationships, that's where, when it just kind of never relents, that would be when, you would definitely want to seek some help.
Are you seeing more patients now?
I'm busting at the seams.
Really? So what I say is true.
Yeah.
Your practice bears that out.
Yeah.
Well, do you normally try to work with people for a finite amount of time to get them over a hump, or do you work with them long term, or I guess both, depending on the individual circumstance?
It does. It really depends on your story and your needs. I found that 4 to 6 sessions can sometimes make a huge impact.
Right.
I think sometimes when there's more complicated life stories going on, sometimes you do need therapy for longer. Sometimes something is causing the anxiety to surface, right? If there's a background of trauma or if there's a family history, a difficult family situation, sometimes you need a little bit more than 4 to 6.
Have we, I didn't mean to cut you off, but have we overcome the stigma of depression and anxiety? And on that note, are you seeing more men? Growing up as a male, we were taught to, just man up.
Suck it up.
Right. And not, men don't cry, we don't get anxious, or if we do, we don't show it. Right. Has that changed, or is there still that stigma?
And that's really unfair, right?
I agree. I think so.
I think all humans, male, female, young, old, we're all going to feel this gamut of emotions, whether we acknowledge it or not. And I think that's maybe one of the issues. We're not being authentic. We're not being really allowing ourselves to recognize that today was hard or today was fantastic, like letting us feel the whole range.
And I would think that masking your anxiety only makes it worse. If you repress it, it's gonna manifest itself in drinking, being rude to
people. It's gonna come out. It's just maybe gonna come out, like you said, in a way that you don't want it to. Panic attacks or depression or which is unfortunate.
Martha, how did you get into this field? I would imagine it takes a certain type of personality, his or herself, to get into this field. I couldn't listen to people talk for hours at a time. How'd you get into it?
I really love it. I mean, it's really the most rewarding career I could imagine. I mean, brave people come into my office and they share their life with me, and I'm able to be a part of their journey and give them some strategies and techniques that can possibly really, turn it around for them. It's wonderful.
Well,
it's wonderful.
Let's talk about that. Are there techniques you could share with us that perhaps, I mean, you don't want to give away your whole practice, your whole trade, and we'll tell people how to get in contact with you before the show ends, but are there simple things you can do? I mean, if you feel stressed out on a given day, what do you suggest?
Yeah. I would say having a self-care plan, having a plan in place of things that refresh you. Study after study has shown we do really well in periods of intense focus, where we're focused on a task or we're doing a task, and then periods where we disconnect and recharge. So what are those things that help you recharge, and being able to do those frequently, right? Is it being with people you love?
Right.
Is it time alone? Is it a bubble bath? Is it taking a run? You know what activities really recharge you, and we got to make time for them, or the stress is going to be high.
BAM South is primarily for a business audience, even though we welcome everyone to read and listen to what we do. But are you seeing more business people under stress now? Are you seeing more business people as clients?
Sure, yeah. I mean, I really see the whole gamut. I see stay-at-home moms, I see professionals, I see med students. It impacts all of us. For sure.
And children, you mentioned, you do, there's no age limit.
Yeah, I think children too. I think the pressures in school start so early. We're comparing ourselves to each other, and the pressure is there. And like you said about the stigma earlier, I think that's something that we're continually trying to work on to decrease that. And I think the more that we talk about it openly, that it's a common thing that a lot of us are facing, that helps to reduce the stigma and to open up the doors, for people who need help.
In the remaining time we've got, I think we should differentiate what you do between, what a psychiatrist, a psychologist,
Sure.
and a medical doctor does. You don't prescribe medication or tranquilizers or that kind of
Correct.
thing. It's more of a talking therapy.
Right, yes. I do talk therapy, and we really focus on behavioral strategies that you could implement to help. So we talk about relaxation, we talk about becoming more aware of your thoughts, and then redirecting those if those thoughts aren't helping you.
Well, and this is holiday season when we're taping this. Everybody gets stressed. Is that normal, or are you getting more people coming in saying, look, the relatives are coming, I don't know what to do, help me. Give us some tips for holiday stress specifically.
We're loaded. We're burning the candles at both ends, right? I think our to-do list triples, and I have to take care of myself too.
Sure.
I think you're right. I'm prioritizing. I'm saying, hey, can some of these things wait till January? Right? And some of them can. Can I, renegotiate some of my commitments, or, so yeah, you want to prioritize, you want to take care of yourself, having time set aside. You may need to say no, right? Sometimes, sometimes we can't take on all of these commitments. And so sometimes, I try to think about, like, what things in my life are a definite yes.
Right.
And if it's not, at times of high stress, like the holidays, if it's not a definite yes, well, then maybe it needs to be a no for now.
Martha, you're a business owner too. I mean, you run a business. Sometimes that may be forgotten. But let me ask you, what advice would you give to someone who, is just at a point where they don't know whether to call, or, I mean, where is that breaking point? Where do you think it is?
Wow.
Is that too tough of a question?
No, I think if you're struggling, if you see that it's impacting your relationships, if you see that your stress is becoming overwhelming, you might even...
You mentioned earlier, no sleep or losing interest in hobbies or that kind of thing.
You might even track it for a while, like just kind of on your calendar or something, rate it on a scale of 1 to 10, and then if you look over the past 2 weeks and you've got like 7 8s, you know,
Call.
well then
Make a call.
maybe it's time, right? Maybe what you're doing to relieve stress isn't so effective.
Let's end on a high note then. What has been your greatest or most personal, fulfilling accomplishment? In how many years have you been?
Wow, I've been in
Yes.
practice for about 10.
Well, okay. On this anniversary, what has been the high point, the pinnacle of your career? Can you name one or two things, or is it helping every individual person?
I mean, it really is wonderful to see that click,
Yeah.
you know, in somebody's life, and to see them come back after a couple of sessions and feel the relief. You know, that's an amazing part of my job. I'm serving as the president of Mississippi Licensed Professional Counselors Association.
Congratulations,
and
right,
Thanks.
right.
And just last May, we did a phenomenal conference, and I have to say that felt like an amazing professional achievement too. And running a business, running a successful business, I mean, that's nice. I know that I'm impacting others, and that feels amazing.
All right, Martha, I'm going to shoot for your last name again, Martha Rosado.
Rosado. We're getting closer.
But I do have a cheat sheet. It's not working, but I have a cheat sheet. If people want to get in touch with you, give us a phone number, get an email address, how can they contact you?
Sure, yeah. Martha at MadisonCounseling.com, MadisonCounseling.org, or MadisonCounseling.org is also our website. So we'd love to hear from you. And with any questions, it's easy to get in touch with us.
It's a noble profession, and I'm sure you've helped a lot of people, and we appreciate what you do, and we appreciate the fact that you're here in Central Mississippi.
Yeah, thanks.
Thank you, Martha. We'll be back with our next segment soon. I'm Jack Chris. You've been watching BAMVision on BAMSouth.net. Thanks.
How's Jim doing? He can't go back to work for 2 months. I don't know what we're going to do. The insurance company won't pay and the bills are piling up.
Honey, you need to get legal power. When Craig had his accident, we called Gil Ladner and Priest, and they won our case.
Well, how do I find them?
Go to getlegalpower.com. Easy to remember. Gil Ladner and Priest to get legal power. With Gil Ladner and Priest, you don't pay until they collect for you. Call or click contact us. Easy as that.
We got legal power and a great settlement thanks to Gil Ladner and Priest.